Hello, and welcome to this brief presentation on health information management. What is HIM and what role does it have in healthcare? Well, HIM is an acronym for Health Information Management and is the practice of acquiring, analyzing, and protecting digital and traditional medical information vital to providing quality patient care. In healthcare, HIM plays a role in providing services relevant to record management, which includes data collection, data quality management, integrity standards, disclosure, privacy of health information, and many more. It improves quality care on both the patient and user end and overall improves the quality of healthcare by providing the best information available for making any healthcare decisions. Now that we've established what HIM is, let's take a quick look at its history. The spark of this profession first started in 1912 when the American Medical and Hospital Associations realized that improvements to documentation quality were required. To do so, they established a club of clerks to evaluate the standards of clinical records in hospitals and other medical institutes. This was done by collaborating with leaders in patient management. Then, in 1928, leaders working with patient records from Canada and America decided to meet, which led to the creation of ARLNA. The Association of Record Librarians of North America. In 1942, a Canadian contingent was created and the association established themselves as CAMRL, the Canadian Association of Medical Record Librarians. Their goal was to provide membership services. Over time, they established a formal college and pursued the standardization of entry-level skill requirements for practice. By the late 1960s, CAMRL decided to make the decision to apply for college status and grant a credential to identify the unique skill set of health record professionals. Then, in 1972, a second charter is obtained to register the CCHRA with its own corporate letters patent. Shortly after, in 1976, CAMRL changes its name to CHRA in order to become consistent with progressive and proactive international-based healthcare. Then finally, in 2003, the CHRA becomes CHIMA due to the rapidly expanding need for use of health information, which caused rebranding to be instituted. With the rebranded association, CHIMA presents itself with a new strategic direction and marketing/communications framework, which now represents certified health information management professions and provides a foundation for careers in health informatics. Now that we've finally learned about the history of HIM, let's view what it takes to work in an HIM profession. There are 4 main steps. First, you must graduate high school or provide the equivalent, a GED, with the appropriate math, English, and science courses taken. Then, you must apply to a health informatics program at a post-secondary school of your choice. Upon acceptance, you then must successfully complete the program and complete any co-op placements if the program/institute offers any. Finally, you must graduate the program and lastly become certified through CHIMA with your choice of certification. In the last step of becoming a part of the HIM profession, you may have realized that I mentioned how you can be certified through the choice of your certification. CHIMA offers a variety of certification options. The first being a CHIM professional, which is a certified health information management individual that is competent in many areas like governance, data quality, clinical knowledge, analytics, privacy, and technology. Another is CCCS, which is a classification and coding specialist that deciphers clinical documents, inputs health data, and influences decision-making at the organizational, provincial, territorial, and national level. Another certification option is CTSS, which is a terminology standards specialist who lead effective health information, assist with electronic health record systems, and provide clarity to the evolving industry. And lastly, there is CDS, which is a clinical documentation improvement specialist that refines case mix to improve Canadian quality records and ensure that the appropriate utilization of resources can be achieved through quality clinical documentation. The current state of health information management is very interesting as it is going through many changes. With the demand for healthcare over the past few years, there have been gaps as well as opportunities for him. The current state consists of the following: a shift in fee-for-service to value-based delivery and payment. An increase in patient privacy, cybersecurity, and digital protection. More patient-centered care, and lastly, high use of technology and patient portals. With the information stated above, it can be. This state will not stay foundational for him as the current state is always changing. Thus the gaps and opportunities presented are goals, and professionals are continuously working on and continue to do so.